Indeed, and thank you very much for this question. I hadn't taken that angle in my response. We understand that with global warming, there's certain types of crops that are actually reduced in nutrient content. So the micronutrient content of a number of key crops is declining as the weather changes. And so that means where we used to get a certain level of nutrients in the diet that we have, this is no longer assured. And so for many of us who are not fully conversant and even aware of the fact that the same tomato that we ate, or let's say the wheat and barley and cassava we're eating, is less likely to provide us with the same catalytic and nutrient intake. So we are eating, let's say, less nutritious food at the same volumes. And this has a definite impact. So we see in mainly urban areas, a rise in obesity, which is a huge additional burden in our health systems across Africa, which are not well, ill-coped and resourced to meet this challenge. And so there again, there has to be mass communication and education of both urban and rural populations around the dramatic effects of climate change, and a re-education around what a healthy diet looks like, and what combination of foods do you now need to eat, which has been different from the past. Traditional consumption patterns are very notoriously hard to break, but with this additional information and mass communication campaigns, it could happen. The additional point I want to say there, the cost of a healthy diet, of course, in Africa is out of the reach of many. And with the COVID pandemic, it is actually exacerbated. So I think the challenge for all of us active in this arena is to really reduce this cost of a healthy diet in terms of the carbon and the biodiversity footprint on one hand, but also just in terms of price and affordability on the other. So I think this is really the challenge of our times.